Good evening, everybody. I am Dr. Padmavati. I am the consultant pathologist in Aster Ramesh Hospitals, Guntur. In continuation to the previous video that I have made, I am going to talk about pediatric low-grade gliomas now. 2021 classification 2021 classification has created a distinct category for pediatric gliomas, pediatric diffuse gliomas, because their molecular characteristics are different and their prognostication is different. So pediatric diffuse gliomas are divided into low grade and high grade tumors, and when you talk about pediatrics, the gliomas that occur in the children and young adults is what we call it as pediatric low grade, pediatric gliomas. Now in today's video I am going to talk the main things about pediatric low grade gliomas. See, as conventional pathologists, where many of us do not have access to the molecular characteristics, what is important, what we should know about pediatric diffuse gliomas low grade, and when do you send them for molecular markers. Now pediatric diffuse gliomas low grade are divided into four categories. The first category is diffuse astrocytoma, MYB or MYB L1 altered. My dear students, you all know what is meant by MYB pathway. This we read about it in neoplasia class, neoplasia chapter. So MYB, that several transcription factors are produced in MYB which are responsible cell proliferation and neoplastic transformation. Then MYB L1 altered is proto-oncogene like factors which are again several transcription factors. Now the importance of this group is it has low cellularity. When you see under microscope, it resembles normal glial tissue, and when the clinician and the radiologist say that this is a glioma, and when you are seeing something like this, then you send it for higher center for molecular markers. Then the next is angiocentric glioma. See, the name itself says angiocentric, that is around the blood vessels. In this group, the glial cells which have low, which do not have any high-grade nuclear features, they have all low-grade nuclear features, are present around the blood vessels either singly or in multiple layers and in rosette formation. And angiocentric gliomas, the molecular also is like diffuse low-grade glioma. So when you are seeing something like this in pediatric age group, again send it for molecular markers. Then the next group is polymorphous low-grade neuroepithelial tumor of the young. The whole idea of making this video is about this entity. This entity, there is a diffuse growth. The morphological features are like oligodendroglioma, perinuclear halo, branching capillary networks, calcifications. When you are seeing such a kind of morphology, ask for CD34. See, IHC markers all of us have. So this tumor will give diffuse positivity for CD34, and you can make a diagnosis of pediatric diffuse gliomas basing on CD34. Then the next category is MAPK pathway altered diffuse low-grade glioma with fibroblast growth factor 1 involvement. So what is this MAPK pathway altered? MAPK pathway. PK is protein kinase. We all know that protein kinase is the most essential enzyme in signal transduction, and MA means mitogen activated protein kinase. This also has oligodendroglioma-like features, again low-grade morphological features. This is negative for CD34. So in pediatric gliomas, where in the pediatric gliomas, pediatric age group gliomas, if you are seeing a tumors like this, send it for molecular markers, you will get the most appropriate diagnosis, and if you have CD34, we can make at least some diagnosis in this case. Thank you. I will get back to you with high-grade gliomas in the next video.